I've just been recently introduced to Alex, and a very wonderful young man, and he has a great story to tell you, and it's not just about depression. He's actually going to open the door and let you into his life. And this is his first real public speaking engagement since about, 5 years ago? So please give him a warm welcome, and I'm sure it'll touch you, and you'll learn a lot from this young man in the short period of time that we're here. So thank you. Alex?
Hi. Well, the whole thing just kind of starts, I started feeling like this dead feeling inside. Like I just didn't feel alive around the ages of 5 or 6. And it progressively got worse till about the age of 12. Then it kind of plateaued for a bit, and I started doing drugs to try and get over it. That made it worse. And through 12 to probably 14, I got progressively worse with the drug use, and that just continually dropped the depression into the darkest, deepest pit it possibly could have been. And started harming myself and trying to force myself out of this thought, like, I didn't want to feel as terrible as I did, and I didn't know how to change it. And I've realized now there is no way to change it. It gets better, but it doesn't go away, is what I'm trying to say. You can cover it up with whatever the hell you want to cover it up with. Anything works, but it's not going to change it. You need to try and find like the root source of your depression, your kind of, I don't know what to call it really, but like for me it was like my mind just said, you don't function. And then I decided I would let that go, and I didn't function. I spent like forever just kind of walking like a zombie of sorts. I didn't really live life. I wasn't passionate about anything. I didn't care about anyone. I was just there. And what everyone needs, I should say, is just someone there to talk to, someone there to give a damn about them. And the more the merrier in that case. The more people that care, the better and easier it's going to be. And just like, I don't know, if the person who is depressed isn't going to talk about it, they're not going to talk about it. There's no opening up that door. There's no saying, hey, talk to me. It's them, they're just going to say, nope, not talking, go away. And it's not going to work. When they finally realize they have gone to hell and back, they will decide that they want to talk to someone. Either they reach that point or they don't, and they just keep getting progressively worse. I mean, in my case, I just kept getting progressively worse. I never really reached that point until, like, after about 7 or 8 drug overdose suicide attempts, I got up on the top of an overpass, and I was hanging on the outside of the overpass, hanging onto the bar and leaning out, like, just ready to let go. And literally 90% of my family pulled up behind me in like 1,000 different vehicles and just got out and said, if you're going to do it, we're going to watch. And that was kind of the pivotal moment that made me realize people actually give a damn. They actually care. And that was the eye-opener. I let them pull me up, and I went home, I calmed down, and then I started thinking, why do I feel this way? Why do I think this way? What can change? What can be made better? And for me, it was a lot of personal life changes. Quitting the drugs. Living a normal life, actually getting out of the house and doing stuff was a big thing for me. I never did anything. I was like the rodent of the house. I sat there and wallowed in my own filth, for God's sake, and I really could have cared less. And after a while, like after this event, I started saying, hey, I need to start taking care of myself, getting out of the house, quitting the drugs, maybe just start living. And I focused more on how to live rather than how to not live. What I mean by that is, like, instead of focusing on how to kill myself, I focused on how to be happy, how to just focus on better things. And that took a lot of work. There is no easy way out of this depression crap. There's no way to get out of it easily. At least there wasn't for me. I mean, I doubt there is for anyone, but I just found that you need support. I needed support. I needed people to talk to constantly. I always needed someone there that I could say, hey, this is wrong. What can I do to fix it? What can I do to change this situation and make it so I don't feel like absolute crap in this situation? And that was with literally any and every situation you can name, from making coffee in the morning to going to sleep at night. It was just every time I did something wrong. I felt terrible. There was something bad about it. Everything I did, everything that anyone else did, there was something wrong with it. There was something bad about it. And that mindset didn't change for a long time. And when it finally did, it was just like, it's not just like an aha moment, but that's kind of how I have to describe it because I don't know how to describe it. It kind of like hit me and I was like, why do I bother? I think like this. I think like all I want to do is kill myself. All I want to do is like hurt myself. All I want to do is end my life. All I want to do is this. All I want to do is that. And I never thought about all I want to do is be happy. And when that finally clicked into my head, which took a long, long time to do, I started realizing there were better things. There was much better things than just sitting around doing nothing, contemplating suicide and making plans for yourself. Like, for example, read a book, go for a walk, talk to a friend. You can do any number of things that are better than planning your death. I mean, it's ridiculous. I never even imagined there was so many activities in life until I got this kind of smack in the face and realized there was more to life. And I don't know. I really don't know where else to go. That's one of the things that came with when I don't want to say recovered, when I got past the brunt of it. Like, it's still there, it still eats at me, it's a day-to-day battle, but I know now what can happen, the low spots you can reach, and I've decided I don't want to see anyone else there. I don't care who you are, what you do with your life. If you feel like you want to kill yourself, you need help. That's the way I perceive it. And I always try my best to help anyone who needs help. I don't care if it's with homework, with cleaning their room, or if it's with depression. If they need someone to talk to, I'll talk to them. I really couldn't care less who you are. If you need anything with that, I don't know what to call it, really. It's not really, I couldn't call it a disease because it doesn't kill you fast enough, but I can't really call it anything else because there's no any other way to put it. In the depressed person's mind, it doesn't kill you fast enough. But once you get over the brunt of it, once I got over the brunt of it at least, I was able to say, I can help other people, which will help me help them again, which will also help me, and it's a big repeating cycle. Once you start helping people, it just helps you and that other person more and more until eventually you I don't know, you kind of reach a plateau, I guess. I've never really gotten that far. And just to kind of finish this all off, stigmas are a load of crap. Like, Should there be a stigma around homosexuality? No. Should there be a stigma around African American people living in North America? No. Well, why should there be a stigma around mental health issues? Depression, anxiety, all that other crap? There shouldn't be. And I don't know, this is another weird one. I, myself, have tried so hard to talk to people about this. Like, I have friends who think that I'm a freak because I have depression issues. And it's like, you're not a freak because you suffer. That's like saying if I punch you in the face and break your nose and you suffer, you're a freak. It doesn't make sense. That's all.
Thank you.
Thank you, Alex. We applaud you, Alex, and commend you for your mission to help other people, and you are doing just what you said. You are helping us reduce the stigma, because we don't want that stigma out there anymore either. And tonight, we are going to learn more about depression, what it is, what the signs and look-fors are, the treatment, and what we can do. And now, without further ado, Dr. Cory Saunders.
Okay, so tonight what I wanted to talk to everybody about a little bit was children's mental health. When I say children, of course, I mean anybody who is not technically over the age of 18. So basically it's for children and youth. And what we really wanted to focus on as one of the topics in this series was depression, because we know depression is something that quite significantly affects a lot of the youth that we see. And in fact, I know based on the types of youth that come into our center every day, we are seeing more and more complex problems from those youth. And a lot of times what we are seeing is a lot of depression. It's a big issue. So when we look at what we refer to as school-age children, so individuals who are still going to school, what are the most common mental health issues we see in those individuals? And what I can often tell you is that anxiety and depression are the two top ones that you're going to see. They are the most common. Where do they come from? We know they come from the brain. There's something that is there in the brain in terms of the way in which the brain processes information and the way in which the brain chemicals work that causes individuals to have symptoms associated with anxiety and depression. But what we often do is make assumptions about what we see. So when we see a behavior that a person is exhibiting, we'll basically say, that's because of this. So for example, if you have an individual, which we'll talk about a little bit more in a bit, who has problems related to depression, they could very much have some what we call externalized behavior, meaning that they are likely to engage in unsafe behaviors. They could be angry, they could be aggressive, they could do all sorts of things like that. We don't often look at them and say, you're depressed. We look at them and say, you're angry. And we miss the boat on what's really going on. So one of the things that's really important is that we think about when we see behavior, what does it mean? Where does it come from? So this one here is, it's normal to be sad. Kind of like this slide because it makes a point. We expect people to have a normal range of emotions. We want people not to be flat and to have no emotions. We expect people to have ups and downs. So people can be sad. Being sad does not mean that you're depressed. There's what we call a continuum. And the issue becomes, when does something like sadness become something that we would consider to be a problem? We know that when people are sad, sadness can last a long time. We can have short periods of sadness, we can have longer periods of sadness. We can often have sadness that is either culturally or contextually dependent. So for example, if you have a death in the family, you're likely to be sad for quite a long time. That is dependent upon the context. It's because something has happened. So the question is, when does it become something more? If you actually look at what is currently the psychiatric, I guess you could call it, classification for depression, what they say is that you have to have 5 or more of these symptoms, and they have to last for at least 2 weeks. So things like depressed mood, having a lack of interest in things, decreased pleasure, you can have weight loss, weight gain, you can have insomnia, you can have hypersomnia, you can have psychomotor agitation, which means that you're hyper. You can have psychomotor retardation, which means that you're lethargic. You can have fatigue, loss of energy, feelings of worthlessness, inappropriate guilt, poor concentration, poor attention, indecisiveness, or recurrent thoughts of death and suicide. When you look at those symptoms, most people would say, I could probably fit into one of those categories every now and again. Because who hasn't had trouble sleeping or felt like they needed more sleep? Who haven't had changes in weight loss, weight gain, things like that? People experience these symptoms. When we have a lot of them and they last a long time, then it becomes something we're more concerned about. If you look at this nice graph here, it kind of shows different changes in moods. People don't have one straight line of mood. Their moods go up and down. So as you can see from the top line there, we would consider that to be normal mood. We see the mood going up and down, and for the most part it stays above the green line, but occasionally it dips below because people who have everyday normal lives, quote unquote, sometimes get depressed. What we do see, however, though, is when you look at something like dysthymia, which is considered to be a milder form of depression, we will see that for the large amount of that time, that those people are never in their happy mode. They're more often in their sad mode. And then when we look at depression, which is more of a major depressive disorder, if you want to think of it that way, what we see is that for those people, they're typically in a really sad mode, not a sort of minor sad mode. So there's a little bit of difference in terms of the way in which we see those people functioning. But what you notice is that for all of them, there are fluctuations. When we think about individuals who have depression, one of the big things that we often see with them is what we refer to as thinking roadblocks. So in essence, a thinking roadblock is this idea of having some sort of, you can think of it as a thought process or whatever, that interferes with the way in which you interact with your environment. So an example of this would be all or nothing thinking, what some people call black and white thinking. So the idea is that if something happens, you're automatically going to think about it at an extreme. You're not going to think about it as it would be in the middle. Another one would be overgeneralization. So the assumption is that, because this happened, then it's always going to happen. Things like a negative filter. So perceiving everything in a very negative light. Discounting positives would be another one. So if something good happens, we say, it's never going to happen again. It wasn't that good anyway. Jumping to conclusions, making an assumption based on something that has happened. Catastrophic thinking, making what's going to happen is going to be the worst possible thing, and that's the one that's going to happen. Emotional reactions. Basically, reacting to situations, not thinking it through, not thinking about what's a logical response in this case, but in fact, basically, how do I feel right now? That's how I'm going to react. And the last one will be personalization, which basically means you're going to take everything personally. It's all about you. If something happens in the world, it's your fault. It's all about you. These are the type of roadblocks that you will sometimes see in individuals who have depression. When we think about depression and what that means at the end of the day, what we know is that it often comes from a family history. Family history is one of the biggest risks for individuals with depression because we know that there's a significant heritability factor for it. We know that it comes down to an imbalance of chemicals in the brain, particularly serotonin. So often, of course, what people do is you get drugs that are serotonin reuptake inhibitors, and that's what helps you with the depression. But we know it comes down to that. However, we also know that things like difficult life events or traumatic events that can happen in childhood, could be things like abuse, neglect, or even things like divorce, domestic violence, those sorts of things can all have an impact on whether or not that depression comes out. Gender is another big one. Women are more likely to have symptoms of depression than men. Increases in stress cause increases in depression, and chronic illness is often related to depression because it interferes with the way in which you would normally do things in everyday life. So what we often see is that people can have a predisposition, meaning that there's something in their background that would say that they're at risk for developing depression. And what happens is certain things in the environment often bring that risk into a reality. When we think about children and depression, it's a little bit difficult to really see depression in kids. There's 4 different things that you can look for. Emotional signs would be one, cognitive signs would be another, physical signs would be another, and then behavioral changes. Not every child who is depressed is going to show every one of those symptoms. So when you think about the emotional signs, what we often look at is the idea that those typical moods or emotions that kids have or that they experience are going to be magnified somewhat. So we see things like sadness. We do see things like a loss of pleasure or interest. We do see some anxiety. There's a huge overlap between anxiety and depression, especially in little kids. The other one that you typically see here, which you don't see as much of in adults, is anger or irritability. We often see kids going through something we refer to as masked depression. And usually when we talk about masked depression, what we're talking about is that the anger, the outbursts, the temper tantrums, all those things actually mask or, obscure the depression from view. So what we see again is the behavior. We see the temper tantrums, we see the outbursts, and it's often focused on what can we do about those behaviors, but we're missing what's hidden behind the behaviors, which is the depression. As I mentioned before, when we think about the cognitive impact or the thinking impact of depression, we see that depression can bring on these negative thoughts. So when we see it in children, what we look for is things like difficulty organizing thoughts. So these kids can be a little bit disorganized. They can have very negative views. They can feel worthless. They can have feelings of guilt. They can be helpless. They can feel isolated. And sometimes we see them have suicidal thoughts. What's interesting about this, again, is that sometimes we get kids, for example, who are diagnosed as ADHD because they're seen as being inattentive and unfocused, when in fact it's some of the depression is actually interfering with their ability to focus. So we're seeing a different type of pattern come forward.